If we consider BRD, it's a complex disease. At Boehringer Ingelheim, we've identified a BRD battle plan, and this is a holistic approach to dealing with a very complex disease. We realize that this is not going to be a simple solution to fix this problem. When we look at the three core tenets of the BRD battle plan, the first one is immunity. And if we think about an animal that is going to be resistant to infection, a key part of having that resistance is building up good immunity. And we can do this in numerous ways. The primary way that we focus on this is through vaccination. So having an animal that has a good nutritional plane, good husbandry, good environment to survive and thrive in, those are key parts to making sure that animal has a good immune response when we do vaccinate. Good parasite control is another key part of making sure that that animal has the optimal or best immune response as possible. The second area that we look at would be more management-related factors. And these would be things such as, I mentioned, animal husbandry. So pen spacing, bunk spacing, water availability, quantity and quality of water, having a balanced ration. Overall, what environmental and management factors can we employ that's going to have this animal minimize BRD challenges through infection, and if it does get infected, respond appropriately. When we look at the third tenet of the BRD battle plan, it's treatment. Antibiotics are the best tool we have when we look at BRD treatment. There's some things to consider when we identify an antibiotic as an appropriate intervention. We know that there's 4 primary bacteria that are involved in bovine respiratory disease. So having an antibiotic that certainly covers those 4 primary bacterial pathogens is very important. The second thing is speed of action. We know that these bacteria can replicate and reproduce very quickly. So having an antibiotic that reaches the site of infection, in this case, the lung tissue, at a rapid rate is very important. Another thing to consider is the post-treatment interval. In operations, we need to identify antibiotics that have a longer interval for post-treatment and identify what that optimal post-treatment is through working with our veterinarian.